We are addressing important health issues that need some attention, one being cervical cancer. Joining us now is the Director of OBGYN at DAP Health, Dr. Rhett Papa, and OBGYN provider at DAP Health, nurse and midwife, Meline Rubinick. Welcome.
Thanks so much for having us.
So glad to have you. Let's start with you, doctor. Tell us why cervical cancer screenings truly matter.
For cervical cancer, you can actually catch it before it becomes cancerous, in its pre-cancerous stage. If every woman and individual that needs her cervical cancer screening is getting it done, cervical cancer should never happen.
Correct me if I'm wrong, but in the beginning, it's hard to detect. There are no symptoms, right?
Correct.
So you wouldn't even know that's what makes the screening more important?
Mm-hmm.
Like Dr. Papa mentioned, it's just something that's totally preventable. It's 2025 and nobody should be dying of cervical cancer in America. So by getting screening early and detecting it, we can prevent really bad outcomes from happening with a really simple and easy swab.
So do you have to actually go in first to get the swab?
You come in to get the kit, and it's a little bit different than your traditional PAP test. So it tests only for HPV, not the full cervical cells as a full traditional PAP.
Well, you're a woman.
Yes.
You know how uncomfortable it can be sometimes.
Definitely.
Talk a little bit about why it's so important to have these services and for people to utilize them.
Having these services available that are safe and private and where people feel like they can trust their provider is just so important for access.
Trauma does come into play here. If any woman has had some form of sexual trauma, any person, I should say, getting that kind of exam is uncomfortable.
Definitely.
So how can you put their mind at ease that it's a safe place?
Absolutely. So I always let my patients know that they're in control of the exam. If they need to stop, take a break, come back to it at another time, anything that I can do to customize it to be an individualized experience, I'm happy to do any of those things. We've done other things like play music or have a friend in the room, anything that makes the person feel comfortable and safe.
Talking about it sometimes relieves that main anxiety, describing, showing some diagrams and some descriptions, explaining what it's going to entail a week, 2 weeks, even a month before it actually happens, so that a patient can not be surprised by what's going to happen. I find most patients will say, you know, Dr. Papa, that wasn't quite as bad as I thought it was going to be when they've had their first, physical exam.
Such valuable information. Thank you so much to both of you for being here and shedding some light on this important topic.
Thanks for having me.
If you think you might be due or overdue for a checkup, the best next step is to talk with a clinician. Call 760-323-9255 or visit daphealth.org to learn more or schedule an appointment.